Okay, greetings. This is Revereskye's Essence. Before we even get started, it's going to be allegedly, okay? Trying to see can I find what I was looking at last night. I was listening to a video who was like, you could go to the National Library of Medicine to look up certain stuff. So, let me just type in trials because I was looking at clinical trials. So this is ClinicalTrials.gov. And as you can see, it says the U.S. government does not review or approve the safety and science of all studies listed on this website. They don't review or approve the safety. Okay. Now it was interesting. So these people do trials on people. But I found something where they wanted to do trials on healthy people. And as you can see, it shows where they're going to do the trials. Scoliosis iron supplementation study. Not yet recruiting. Venous, see how that's in New York? Venous thrombosis prevention and sleep quality. A comparison of the Kendall and the Recovery Health Max system. Deep venous thrombosis of deep femoral vein. Gonna do that in Massachusetts. All these are new. Anti-inflammatory effects. So they're gonna try this. I guess they're gonna try this medicine in psoriasis, North Carolina. Comorbidity, burden, and use of concomitant medications at the. Okay, it was something else. Conditions. This is the one I was looking up. If you see this, NCT 0444. See, when I just click it, things pop up. But this one, these two numbers right here, you see they're just numbers. They're not like this. They're just codes, right? Watch this. Here it go. See how that just popped up with a code? So they didn't even use this word. Okay, so look. They withdrawn from this one. They withdrawn from it, right? Safety and that don't look like efficiency, but safety and something of tafenib in hospitalized patients with COVID-19 pneumonia who are receiving standard of care therapy. So they was withdrawn from this one. And the conditions, COVID-19, locations, Hartford, Connecticut, Shreveport, Louisiana, Iowa City, Iowa, Cleveland, Ohio. But they completed this one. NCT 04368728. They completed it. Now peep this. I want you to see some. Study to describe the safety, tolerability, immunogenicity, and efficiency. I don't know. Efficiency, I guess it's efficiency of the RNA vaccine candidates against COVID-19 in, this is the clue, in healthy individuals. And they completed this. So they ran this study on healthy people. And remember now, allegedly, the whole purpose, remember when they were saying, if you have any health conditions or anything like that, you would want to, possibly take the Jabberwocky, right? But it seems like everybody that passed away had some type of condition, so they never had to go back and list it. They never had to go back and list it as this. Or they listed it as this, but always some underlying issue, right? But look at it again. Study to describe the safety, tolerability, how much you could tolerate, immunogenicity, and the efficacy of the RNA vaccine candidates against COVID-19 in healthy individuals. Remember, this is study, research, educational purposes, because I came across this website. Now, where did they do this study? Remember, they did this on healthy individuals. They did the COVID-19 and they did the SARS-CoV-2 infection. Okay. They did it in Athens, Alabama. They did it in Huntsville, Alabama. They did it in Birmingham, Alabama. And they did it in Mobile, Alabama. That's why. Oh, they got more locations. Let's see. Oh, they got it in a lot of places. That's just the Alabama locations. Arizona locations. They did this on healthy people. California. Florida. They did it in Jacksonville. 2 places. They did it in Hawaii. They did it everywhere. Kansas. Start from the bottom. Let's see what we got. Turkey. Istanbul, Turkey. Cape Town, Africa, South Africa. South Tanzania. No, that ain't Tanzania. That's Zimbabwe. Did it in Germany. Brazil. Argentina. Washington. Virginia. Utah. Texas. Tennessee. Carolinas. Rhode Island. Pennsylvania. Oregon. Oklahoma. Ohio. Ooh, Lord, Ohio. North Dakota. North Carolina. Look at all the North Carolinas. What? New York. New York, New York. New Mexico. New Jersey. Las Vegas, Nevada. Omaha, Nebraska. Montana. Michigan and Mississippi. Gulfport, Mississippi. Massachusetts, Maryland. Louisiana. Kentucky, Kansas, Iowa, Illinois, Idaho, Hawaii, Georgia. Not many in Georgia. That's interesting. Well, of course, Atlanta. They even did it in Columbus, where I'm from. Orlando, Florida. Miami, Jacksonville, Hollywood, Hialeah, Fleming Island, D-Land, Coral Gables, Connecticut, Colorado, California. Oh, California. Arizona, Alabama. Participation criteria. That's why I say it's time to do research and study of what's going on around you. You don't know what's going on around you. Researchers look for people who fit a certain description called eligibility criteria. Some examples of these criteria are a person's general health conditions or prior treatments. For general information about clinical research, read Learn about studies. Eligibility criteria, inclusion criteria, male or female participants between the ages of 18 and 55 years, inclusive 65 and 85 years, inclusive or greater than or equal to 12 years, inclusive at randomization, dependent upon study phase. For the boostability and protection against VOCS VOX subset, existing participants enrolled to receive a third dose of the BNT162B2 at 30 UGs or the BNTI62B26A, male or female participants between the ages 18 and 55, inclusive at re-randomization. Newly enrolled participants enrolled to receive 2 doses of this. Male or female participants between the ages of 18 and 55, inclusive at enrollment. Existing participants enrolled to receive a third dose at 5 or 10. Male or female participant 18 years of re-randomization. Note that the participants 18 years of age cannot be enrolled in the EU. Participants who are willing and able to comply with all scheduled visits, vaccination plan, laboratory tests, lifestyle consideration, other study procedures. Healthy participants who are determined by medical history, physical examination, and clinical judgment of the investigator to be eligible for inclusion in the study. Participants who, in the judgment of the investigator, are at risk for acquiring COVID-19. Boostability and protection against VOX. Existing participants subset only participants who provide a serum sample at visit 3, with visit 3 occurring with the protocol specified window. Capable of giving personal signed informed consent. Exclusion criteria. Other medical or psychiatric conditions, including recent within the past year or active suicidal ideation, behavior, or laboratory abnormality that may increase the risk of study participation or, in the investigator's judgment, make the participant inappropriate for the study. Phase 1 and 2 only. Known infections with human immune deficiency virus, HIV, hepatitis C virus, that's HCV, or hepatitis B virus, HBV. History of severe adverse reactions associated with a vaccine and or severe allergic reactions, e.g. anaphylaxis to any component of the study, interventions, receipt of medications intended to prevent COVID-19, previous clinical based on COVID-19 symptoms, signs alone if a SARS-CoV-2 NAAT result was not available, or a microbiological based on COVID-19 symptom signs and a positive SARS-CoV-2 NAAT result diagnosed with COVID-19. Phase 1 only. Individuals at high risk for severe COVID-19, including those with any of the following risk factors: hypertension, diabetes, mellitus. I wonder what diabetes mellitus is. Chronic pulmonary disease, asthma, current vaping or smoking, history of chronic smoking within the prior year, BMI 30 kilogram M2, anticipating the need for immunosuppressive treatment within the next 6 months. Phase 1 only individuals currently working in occupations with high risk exposure to SARS-CoV-2, healthcare worker, emergency response personnel. So they're out of the picture on this one. Immune compromised individuals with known or suspected immune deficiencies as determined by history or laboratory physical examination. Phase 1 only. Individuals within a history of autoimmune disease and active autoimmune disease requiring therapeutic intervention. Bleeding, diathesis, or condition associated with prolonged bleeding that would, in the opinion of the investigator, contraindicate the intramuscular injection. Women who are pregnant or breastfeeding, previous vaccination with any coronavirus vaccine. Now, wait a minute. Why would they do that? Aren't they healthy? Aren't the vaccinated healthy? Individuals who receive treatment with immunosuppressive therapy. Now, wait a minute. Exclusion. And this one is inclusion. Okay, so this is people that are excluded. Previous vaccination with any coronavirus vaccine. But I thought they said if you're healthy. Individuals who receive treatment with immune suppressive therapy include cytotoxins, agents, and systematic corticosteroids for cancer or autoimmune disease or planned receipt throughout the study. Phase 1 only. Regular receipt of inhaled, nebulized corticosteroid, receipt of blood plasma products or immunoglobulin from 60 days before study, intervention, administration, or planned receipt throughout the study. Participation in other studies involving study intervention within 28 days. To study entry through the including 6 months after the last dose. Study intervention with the exception of non-Pfizer interventional studies for prevention of COVID-19, which are prohibited through the study participation. Previous participation in other studies involving study intervention containing lipid nanoparticles. Phase 1 only. Positive serological tests for SARS-CoV-2, IgM and or IgG. Antibodies at the screening visit. Phase 1 only. Any screening, hematology and or blood chemistry laboratory value that meets the definition of A greater or equal to grade 1 abnormality. Phase 1 only. Positive test for HIV, hepatitis B, surface antigens, HBsAg, hepatitis B, core antibodies, HBc, ABS or hepatitis C virus, antibodies HCV, ABS at the screening visit. Phase 1 only. SARS-CoV-2 NAAT positive nasal swab within 24 hours before receipt. Study intervention. Investigator site staff or Pfizer employees directly involved in the conduct of the study site staff otherwise supervised by the investigator and their respective family members. Ages eligible for study: 12 years and older. Child, adult, or older adult. Sexes eligible, all. Except healthy volunteers, yes. This is deep. This is deep. They got 3 phases. It says this is phase 1, 2, 3 randomized placebo control observer blind dose finding vaccine candidate selection and efficacy study in healthy individuals. The study consists of 2 parts. Phase 1 to identify preferred vaccine candidates and dose levels. Phase 2 an expanded cohort and efficacy part. The study will evaluate the safety, tolerability, and immunogenicity of 3 different SARS-CoV RNA vaccine candidates against COVID-19 and the efficacy of one candidate. As a 2-dose separated by 21 days schedule at various different dose levels in phase 1 as a booster in 3 age groups. Phase 1, 18 to 55 years of age, 65 to 85 years of age. Phase 2, 3, 12 years of age, stratified as 12 to 15, 16 to 55, or greater than 55 years of age. The candidate selected for efficacy, I don't know how to say it, evaluation in phase 2 and 3 at the dose of 3 UG. Participants who originally received placebo will be offered the opportunity to receive. That's another thing I read. Participants who originally received the placebo, that mean a fake, it's just mind over matter, will be offered the opportunity to receive this one. So they want to put them in the trial too after the placebo at defined points as part of the study. In order to describe the boostability of BNT162 and potential heterologous protection against emerging SARS-CoV-2 VOX. An additional dose of this will be given to phase 1 participants approximately at 6 to 12 months after their second dose. This will provide an early assessment of the safety of a third dose, as well as immunogenicity. The assessment of boostability will be further expanded in a subset of phase 3 participants at selected sites in the U.S. who will receive a third dose at 30 UG or the third or potentially fourth dose based upon the South African variant. Based upon the South African variant, and hereafter referred to as a future subset of phase 3, participants will receive a third lower dose. To further describe potential homologous and heterologous protection against emerging SARS, a new cohort of participants will be enrolled who are COVID-19 vaccine naive. Now, what that means? COVID-19, i.e., naive, and have not experienced COVID-19. They will receive the given as a 2-dose series separated by 21 days. To reflect current and anticipated recommendations for COVID-19 vaccine boosters, participants in the C who meet specified recommendations and have not already received one will be offered a third dose after their second dose of this deep. This deep. Healthy people. What is the study measuring? Pain at the injection site, redness, and swelling as self-reported on the electronic diaries. Fever, fatigue, headache, chills, vomiting, diarrhea, new or worsened muscle pain, and new or worsened joint pain as self-reported on the electronic diaries. as elicited by investigational site staff. As elicited, reporting serious adverse events, reporting systematic events, reporting local reactions. Reporting serious adverse events, abnormal hematology and chemistry laboratory values. Abnormal hematology and chemistry laboratory assessments. Hematology chemistry assessments. Percentage of participants reporting local reaction pain at the injection site, swelling. Self-reported. Fever, fatigue, headaches. Adverse events. Confirmed COVID-19 in phase 2-3 participant without evidence of infection before vaccination. Okay. So that's what they're doing there. Neutralizing antibody levels expressed as GMTs. Neutralizing antibody levels. It's deep. But I wanted to read some of this so y'all can read it. These are the collaborators and investigators. The sponsor is BioNTech. The collaborators is Pfizer. The investigators are the Study Direct Pfizer CT.gov call center. So they got a bunch of stuff. No study documents are available. Okay. Okay, it's so much stuff. But yeah, y'all should check out the National Library of Medicine. You just click Find Studies. And you go from there. I just did clinical trials. And this. And you just gotta tweak it and play with it. You could type in basically anything. So I'm going to leave it there. That was pretty good, just going over it. Anybody could go to the website, National Library of Medicine, and you could definitely check out this one. NCT, this one. NCT 043687828. Check that one out. So there we have it.